From CGTN headquarters in Beijing, this is The Hub with Wang Guan.
Hello there and welcome to The Hub. I'm Wang Guan in Beijing. Recorded COVID-19 cases worldwide has risen above the 300 million mark with over 5 million deaths. Coronavirus variant Omicron was identified only 2 months ago, but it has already fueled a new surge in the US and Europe and elsewhere with record high cases. Hospitalization rates among babies and toddlers are almost at their highest, and hospitals are under siege. Leaders in France, Germany, and Italy have once again insisted on the importance of vaccination and doubled down on punitive measures against those who still refuse to get jabbed. Now, what's more alarming is that after the holiday season and many cross-region travels, Omicron has not shown any signs of abating yet. So how did we get here? And have we identified effective measures against Omicron? That's what our panelists will tell us. Let's now turn to some experts from Hanover, Germany, is Dr. Tanvi Khera. She is a virologist and clinical researcher at University Hospital, Essen. And in Nanjing, China, we have Professor Wu Zhiwei, Director of Center for Public Health Research at Medical School of Nanjing University. And in New Delhi, India, we're joined by Dr. Vikas Bajpai, Professor of Center for Social Medicine and Community Health at Jawaharlal Nehru University. Welcome to all of you. Let me turn to you first, Dr. Khera. Omicron apparently took many countries and their policymakers, medical workers by surprise. We see record numbers in terms of case loads. What do we know about this variant so far?
Sure. So as you rightly just said, that Omicron just kind of, was emerged 2 months back. So it was in South Africa at the end of November. And of course, the threat, whether it's a variant of interest or a variant of concern, which usually is, the variant's name given by the WHO. And I think over the period of time, it was actually designated as the variant of concern. So the difference primarily from the, other words that we've heard, alpha, beta, and even delta, which was quite a deleterious one and had seen a huge impact in countries such as India as well. So the major difference as a virologist, I would say, in the virus per se is its transmissibility. So the transmissibility for this new Omicron is very high, and this is due to its large mutations on the spike region as compared to the Delta, where there were just 18 to 20, and there are more than 30 mutations on the spike region of this Omicron. So the transmissibility for this variant is so high, but there are data that suggest that perhaps the pathogenesis for this virus, that means that the disease causing, so infection does happen and rapidly in all age groups, but the pathogenicity or the the cause of the disease or severity of disease has been low. But again, we don't have enough data from enough regions to actually come to a decision that yes, the pathogenicity is still low. So therefore, the use of vaccines and to prevent yourself with COVID-appropriate behavior is definitely a must.
Right.
So, yeah.
Dr. Wu Zhiwei, let me turn to you. Basically, Dr. Khera was saying that the transmissibility of Omicron was apparently very, very high, but it is somehow proving to be less lethal. Is that your understanding too? What do we know from your vantage point about this variant, Omicron?
From the published works and also from clinical studies, it's I think quite clear that the Omicron's transmissibility is very high, but also in other sense that the deadly cases associated with Omicron seem to be very low. I think it's understandable when the virus is mutating and it keeps changing its some basic structures. The virus ability in causing the disease actually could be reduced. And historically, if you look at the viral diseases, actually as they continue mutating, their ability in causing the disease usually will go down. And some viruses may maintain their transmissibilities for easy crossing from one person to others. As Dr. Khera just mentioned, that Omicron has has numerous changes in its S proteins, which actually happens to be the protein that are used to interact with the cells. And also this is the region where the virus used to evade the immune response. And also we know that the vaccines are largely targeting the S proteins. So it's, from existing data, we know that the Omicron could evade certain vaccine efficacy and also could evade some antibody therapeutic ability as well. So this is basically what we know about the virus.
Right. You're talking about breakthrough cases, which is really frustrating to many around the world, because on one hand, the policymakers cannot emphasize enough the importance of getting vaccinated, but on the other hand, we kept saying the fact that Omicron brought so many breakthrough cases is truly frustrating for many around the world. Dr. Bajpai, let me turn to you. I mean, the situation in India is apparently severe, like in many parts of the world. What's your understanding of this virus so far?
Well, I think, without repeating what my previous speakers have already said, as to the lethality of the virus, I would like to bring attention to the fact that lethality is determined biologically in one way. The other aspects of lethality are determined by the environmental factors, by the social economic factors. And if it goes to the rural areas at large or more susceptible populations, then the way it
Which group of populations, what kind of demographics are more prone, more susceptible to this virus?
Well,
Omicron?
As far as India is concerned, all that we've heard from is about the larger cities, mainly, Delhi, Mumbai, Bangalore and all, and Chennai. These are the places we've been getting all the data from. We don't really know as to its reach in the rural areas, in the hinterland. And well, if it does, and given the nature of its infectivity, then that will create a situation in itself where, as we have seen in the past, the health systems, they get easily overwhelmed. In fact, they are getting overwhelmed already, even in cities like Delhi. Okay, so now it is then factors other than the biology of the virus per se, they come into play in terms of determining its overall impact, may it be morbidity or may it be mortality. So I think while it's good that it has as yet not shown that kind of severity as we saw with Delta, I just hope that the situation remains likewise, but it might yet be a little early to rest on just that.
Dr. Khera, so many people are frustrated, apparently, worldwide. They're asking this question: when will we see an end in sight when it comes to all the variants and mutations of the coronavirus or SARS-CoV-2? So what would be your advice to the people worldwide who might be watching our program? What can they do right now? Should they get a booster shot, or should they, keep observing the social distancing rules? What can they really do to prevent themselves from, getting Omicron?
Sure. So just one thing is there that I think when this Omicron had started and, the transmissibility of it was so high, it came out as if it was like a God sent kind of a virus, that it will create a herd immunity, because everyone will get infected in some or the other way. So it's not something to get scared of. Of course, getting a booster, getting a shot whenever that's available to the public, that is a must, because there is plethora of data, if not plethora, but there is some evidence that has been generated that your T-cell memory responses do get boosted after you get a shot with, if you get jabbed with the vaccines.
So are you saying it's still better
that,
off to get vaccinated versus not getting vaccinated when it comes to
yes,
fending
definitely.
off
Unvaccinated population we don't know whether what kind of protection these vaccines are providing you. So if you're unvaccinated, there is a chance that you will get infected, but there's also a chance that always lingers that if it might just cause a disease progression. So definitely getting vaccinated or natural infection through an infection, if you've been infected, that does give you some kind of protection. So that would be my takeaway.
Right.
And definitely at this point of time, again, social distance measures and COVID appropriate behavior is also a must, like basic hand hygiene, and those are quintessential. So definitely, yeah.
Right. I think many policymakers, many governments around the world are having a hard time convincing their residents to observe those social distancing measures. It's hard to stop people from partying. For example, on a Friday night. Dr. Wu Zhiwei, from your vantage point, what can people really do to preventing themselves from attracting, this virus?
Actually, not only for the Omicron. If you look at the Delta variant, all the viruses actually, we know the coronavirus actually, they will have a breakthrough infections. So basically, that says clearly that the vaccines are very limited in terms of providing new infections, although the vaccines are very effective in reducing the severe cases. That's, I think, is very important, because the key issue we saw in the early stage of the pandemic is that the hospital was overwhelmed, and basically hospitals failed to provide sufficient care and facilities of those infected, and that's one of the reasons why the death rates are so high. Once we have vaccines, we could reduce the severe cases and the hospitalizations. Then people are basically have good control of the viral infections outcome. So I agree with Dr. Khera's point that people should get vaccinated, and if they can, they should get booster shots to increase their antibody titers to get better protections. I think the other issue is that in the industrialized countries, the vaccination rates are very high. Many of them reach over 80%, but in part of the developing countries, the vaccination rates are still very low. Some are even below 10%. I think this is something actually of concern. The WHO's COVAX program basically trying to promote the equal distribution of the vaccines. This is something actually we need to push and get people vaccinated.
Right. Dr. Bajpai, if you look at the United States, over 1 million people got, infected in a single day. That is a staggering number of, people getting infected over there. Joe Biden is still pushing for this vaccination campaign, but should, countries or governments like the U.S. Worry more about vaccinating their population, or perhaps focusing more on, research and development for a new vaccine that, that is targeting Omicron?
I think in the worst of the crisis, one expects that it will bring out the best in us. But before that happens, it seems it is bringing out the worst in the governments around the world. We have a situation at hand where WHO has almost been reduced to the role of issuing just advisories. There doesn't seem to be any international cooperation except between some vaccine producers about how to vaccinate and provide protection to the world at large. Everyone seems to be pursuing their own narrow goals. Now in Israel, they achieved almost 100% vaccination, okay? And then they are testing first booster, second booster, third booster, and with no respite in the cases. So I think it's high time that the countries and the governments around the world, they should realize the limitations of this approach that they have been pursuing till date, because if you leave a vast population around the world unprotected with any kind of a measure, then you will. It's a race to bottom. You will keep chasing the variants as and when they come up. So though in the ultimate sense, I think the agent, host, and environment factors, they will strike an equilibrium. But the point, and the pandemic cannot possibly go on forever. But then before that equilibrium is achieved, the whole idea is that the costs that we have to bear as humans, that should be the least. And this can only be achieved by creating those ways and means and mechanisms whereby world is seen to be coming together to fight this pandemic rather than staging their own lone post fights. And I think then we can also talk of science and collaboration and evolving newer vaccines and all. But I think clearly the available vaccines do not seem to be really offering that kind of a robust protection, though we may still keep pursuing the same line. What effect we are seeing?
Host the Winter Olympics in less than 30 days. One of the most important sporting events, or any event for that matter, in the world. So Dr. Wu Zhiwei, China saw new infections in the past couple of weeks. Dozens of people were contracting Omicron. What really can the Chinese government or the local governments do? I mean, because we have this zero tolerance or zero case policy that is not without its controversy, globally. But for China, really, what is the best way out?
Well, the Chinese government and the games organizers just published a protocol for dealing with the virus. It's called closed circuit management. Basically, the idea is that trying to separate the athletes and the ground personnel and the larger society or the audience from getting close contact. So this is very much based on trying to limiting any possible spreading of the disease and maintaining the healthy situation and controlling the infection. If any, there is any breakout infections, then controlling the infection population into a minimum. So I think that this is something the games organizers are trying to achieve.
But do you think that is attainable for the Winter Olympics to have, zero case or close to zero case?
Well, actually, I can't see whether you can achieve zero case. I doubt, because this is going to be a huge challenge. But the bottom line is that if you could control the infection into a minimum numbers, then the whole game would be maintained, and also everything would be going smoothly. But the critical thing is that how to control this. Contagious virus from spreading into a large population, particularly in the athletes, because you can't avoid body-body contact in many of the games. So I think that this is something which we will be dealing with. China has accumulated a lot of experience in this area. I think personally, I'm pretty confident if things are going well, then it should be able to do it in terms of controlling the virus.
Yeah, it is unimaginable if, let's say, hockey players, one of them got infected with Omicron or any variant of the COVID SARS-2, and passing the virus to other players or players from other teams. That would be a disaster indeed. Dr. Khera, in your opinion, what is the best practice globally? What should governments do right now to really curb the spread of Omicron?
Governments and their capacities are trying. First of all, with kind of restrictions that they impose, not complete lockdowns, but partial restrictions, is only to not, overwhelm the healthcare system. So that is one, because as we, with the earlier speakers also mentioned, that we still don't know that what kind of disease progression will actually Omicron build. Is it going to be similar to Delta? Is it going to be something new? Or is it just like a flu and will just evade, and perhaps the SARS-CoV-2 will just become endemic? So lingering with those, I think, with the booster immunizations, especially for people with comorbidities or people aged over 60, 65, especially with comorbidities or other ailments, should definitely take that booster. and so as for children, because now we see that so many vaccines, they've also started administering it to the children, because children could be the carrier. Because a year back, when we were talking about this scenario, we were only, administering vaccines to the adult population, but we did not see whether these variants can, also infect the children. And children could be the carriers, and they were giving it to their grandparents, to the parents, and also others. And I think the governments, how they are also curbing is by making these restrictions even more stronger. Like, you cannot enter a restaurant if you don't show your vaccine certificate, which is also kind of a mandatory, because even if you think that you're healthy and you don't need a vaccine, but you could still be a carrier and pass it on to someone who, even after a vaccine, has to still wait for a third booster, because again, what we did mention previously about vaccine inequity, so that really is looming. And there was a recent report that alluded that there are around, if we have to end the pandemic by 2022, there has to be at least 22 billion doses of mRNA vaccine that should be produced if we have to really end this. And this is by the commitments of, the companies have only committed 3 or 4 billion of it. So there's still a huge number that is lacking. So, yeah.
Right. I mean, when I interviewed the President of the United Nations General Assembly, he was saying basically no one is safe until all is safe.
Yep.
Everyone's praying that we'll see the end of the tunnel sooner rather than later. But the fact is, we kept seeing all those variants from Alpha to Beta to Delta, and now Omicron. Dr. Bajpai, is there any foreseeable end to this pandemic? I mean, if yes, how far away is it? Because this is really the question that is on the mind of many.
Yeah, I mean, end can be foreseen only if you are looking beyond Omicron. And what I mean by saying that is that you are seriously getting down to the business of improving international cooperation and truly mounting an international response to this pandemic in the truest sense of the word. If I may put it as briefly as that, then this is what is really required. Rest, what to do with Omicron and all, it all falls within this premise. We can do many things. And as far as countries like India are concerned, I think we must realize the limits of any kind of coercion, because that simply does not sit well with the real life conditions of the people. Have to earn daily to be able to eat daily. Apart from prevention in terms of social distancing or physical distancing and masks, such measures, there has to be effective mitigation strategy as well, which will reassure the people that yes, they will be taken care of in terms of any illness that they may have. And simultaneously, there has to be a move by leading actors to mount an international response to the pandemic, which I believe has been talked of off and on, but has not really been come into shape in any effective way till.
Dr. Wu, I mean, what do you think? Because some people are like, Omicron is just like a mild flu. Some people are fearful, of course, but others are like, Omicron is just like a mild flu, and each variant gets less lethal as the virus progresses. Is that true? I mean, how should people come to terms with the new variant?
Well, actually, I'm not sure, but this Omicron, whether it's more deadly or less deadly. But we need to rely on more scientific evidence to come out. But the bottom line is that let's take, let's virologically speaking, that if this Omicron's current understanding, about the virus is indeed just about more, transmissible but less deadly. But if that's indeed the case, that would be a good news. Basically suggesting the virus evolution is going towards the end of this pandemic, because once the virus mutating, get less deadlier, then basically we could treat the disease as a common flu. But I think, what we could do is that as we have the vaccines available right now, people should get more vaccination to increase the vaccination rates, and also equal distribution as well. As the therapeutic drugs are coming out, I think that would give us a second line of defense, basically, for those breakthrough infections, people could get treatment. And I would suggest that the current public health approach should also be implemented. So if we do all this, actually, I think there is still hope that in the new year, we will be able to deal with the virus infection, to reduce the new cases. And maybe that if we are having good luck, then this year we will see the end of the pandemic.
Right, we've heard from top experts around the world basically advising and warning us that current data are not scientifically significant enough to say that the Omicron is less lethal, milder. So, in fact, as many governments would advise, you have to get vaccinated. That was Professor Wu Zhiwei, Dr. Tanvi Khera, and Dr. Vikas Bajpai. Thank you all very much for joining us on The Hub on CGTN. That's all the time we have for this episode. If you have any questions or comments about our program, feel free to contact me on social media. Thank you for watching. I'm Wang Guan in Beijing. Our news coverage continues on CGTN.